Thank you so much, and good afternoon to everyone. It's so good to be here. I'm really honored to be with you today as a European Parliament rapporteur on cardiovascular disease strategy. Yeah, almost every family in Europe has lost a loved one for cardiovascular disease, often sooner than expected and very often without warning. But what strikes me is that collectively we have somehow learned to accept this as something normal. You know, we blame genetics, we blame bad luck, we blame aging, while in reality we should call it what it truly is, a political and societal failure, because the vast majority of the cardiovascular deaths are preventable. Science tells us clearly that most cardiovascular risk is driven by social conditions, by commercial pressure, environmental exposure, lack of prevention, and unequal access to care. And these factors can be changed by the smart policies. And this is why the upcoming Commission's plan and the Parliament's report, which I will table in January, are so important. They will be the test of how ambitious we are, how bold we are, and how unapologetic we are towards the forces that drive the burden of heart diseases. And yeah, we need to be decisive, and structural political action must be taken. And this is how I see, this is kind of my vision, how that should look like. First, prevention is the strongest and most effective tool we have, yet it remains so neglected. Can we change that now? Health education must become part of the basic learning from an early stage. Early detection is just as essential, and the screening those at high risk should be the norm everywhere in Europe, not the exception. And prevention will always fall short if we continue to ignore the commercial forces that actively shape unhealthy behavior. I expect this to provoke a significant backlash, as achieving political agreement on this issue will be extremely difficult. I know that, but nevertheless, I am committed to pushing it forward. So profits cannot continue to take precedence over our health. And in my report, I will suggest a solution to tackle this. Cardiovascular disease is the leading cause of death among women in Europe. So, yet, women remain underdiagnosed and undertreated. So this must be our strong priority. And then we must also face the deep geographical and social inequalities that still define cardiovascular health across our continent. This is why it's crucial that every member state adopt or update a national cardiovascular health plan with the clear prevention targets, with also defined timelines and measurable outcomes. All of this brings me to the most important message I want to leave with you today. Implementation is everything. We have seen it too so many times before. Strong strategies are written, ambitious plans are adopted, and then we fail on our promises. We cannot afford that with cardiovascular disease, the biggest killer in Europe. So this afternoon, we will hear from Commissioner Várhelyi about this vision of the plan, and I sincerely hope that it will be as strong and brave as we expect to be. Because ultimately, our success will not be measured in documents, but in less heart attacks and less premature deaths. So we are facing a historic opportunity. There will be not another comprehensive plan for heart health anytime soon. So if we fail now, we risk condemning ourselves to decades of frustration and missed potential.